A patient today asked about Lexapro or escitalopram. Lexapro is an SSRI or a selective serotonin reuptake inhibitor, and it causes serotonin to be more available in the space between your nerve cells or your neurons. It's called the synaptic cleft, by preventing that serotonin from going back into a neuron that it came out of. So serotonin leaves one neuron, it'll be in that synaptic cleft and then available to either stay there or to move forward to a different neuron as opposed to going back into the neuron that it came out of. Lexapro or escitalopram is used in a variety of mental health conditions, including major depressive disorder and other depressive disorders, generalized anxiety disorder, panic disorder, OCD, and bulimia. For OCD and bulimia, doses tend to be about 40 or 50% higher for many patients than they are for depression. Just for whatever reason, those conditions tend to respond to a higher dose of this medication. Lexapro, we talked previously about Celexa, which is citalopram. Lexapro is the mirror image of the citalopram or Celexa molecule. So just like how two gloves might look pretty similar, you can't put a left hand glove on your right hand, and you can't put a right hand glove on your left hand, even though they are mirror images of each other. These two medications, one of those two medications might work really well for one patient and the other one wouldn't for whatever reason. And so they're two very commonly prescribed medications, but they are different. It's important to note that. But anyway, with regards to Lexapro or escitalopram, there are potential side effects. Your more common side effects tend to be transient. So when a patient starts the medication or increases the dose, it's not uncommon for 3 or 4 days or a week or so to have a little upset stomach or headache or feel more tired, have some aches and pains, feel a little bit lightheaded if you stand up too fast, or just feel a little bit off, like a little bit more sluggish thinking or something like that. I'll often tell patients to take the medication at night so they sleep through the majority of those side effects. And then once they're adjusted to the medication, then they can take it in the morning or noon or at night, whatever's most convenient for them and whatever's going to cause them to be most likely to take the medication, not have any missed doses. Additionally, there's some more significant side effects that patients often worry about. One that always comes up actually is sexual side effects. SSRIs like Lexapro or escitalopram can make it more difficult for someone to climax if they're engaged in sexual activity, and they actually can treat premature ejaculation for men. And so some individuals will say, hey, this is actually a really welcomed or really positive side effect. Other side effects, some individuals can actually have an increased risk for bleeding on these medications. It doesn't tend to be too clinically significant or clinically significant for the majority of patients that I see. However, if I see someone who's older or someone who is on a blood thinner or has a bleeding disorder or another reason why they might be more vulnerable to bleeding or bruising, then I'm going to want to reconsider using these medications, or maybe reach out to their primary care provider or the provider that treats that other bleeding condition to make sure that we collaborate and reach out to each other if there are any concerns that develop between visits. And just like all of your SSRIs, there is a black box warning for suicidality. With that being said, untreated depression is going to be your leading cause of suicide. And so the bottom line is that I believe that if you're struggling with depression, or if someone out there is struggling with suicidal thoughts, it's incredibly important that they seek treatment from a mental health provider and discuss options, whether they be medication management, therapy, or otherwise. But if at any point in the course of treatment, with medications, without medications, and psychotherapy, or just in general, someone develops suicidal thoughts, it's incredibly important to get immediate help. Call 911, go to your nearest emergency room or crisis center, contact your medical or mental health professional immediately, and get the help that you need to stay safe. If you believe this video pertained to you in any way, please reach out to a mental health professional directly to discuss. These videos are informative only and not meant to be medical advice for any patients out there.